It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the Houston area that help change people's lives.
That's right, like our first doctor, head and neck surgeon, Dr. C.T. Nguyen.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Keith had severe sinus problems until he met Dr. James Ludwick. To find out more about Keith's story and other life-changing stories, log on to bestdocsnetwork.com.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisemann and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
We basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, but it was, now that I look back at it, I'm actually really excited and happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you, Kimberly? And that means so much, and especially for an 8 or 9 year old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he asks, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisemann.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
You know, my teenage years and my 20s, it's been difficult. I've been able to interact and do things with people, but without difficulties. Right now, I just have like muscle and bone problems and things like that, but no like diseases or anything. That hasn't affected me in any way.
When a patient gets over a body mass index of 50 and Mr. Sowell's at a body mass index of about 74, he does not have a normal life expectancy because of his weight.
You know, with dieting, you can go out and you can still eat a ton of food, but with the surgery, you try to eat those things, you know, and you have physical problems. You're not able to eat that much as you would to put the weight back on. So the fact that it keeps you in check, but yet it's still, you know, it's not something that you want to abuse in any way. It's something that you really want to take seriously, that, you know, you're ready to live a normal life, you know. I mean, when you're like me and you're almost 30 years old and you've had difficulty, you know, having fun and doing things, you know, it gets where it's tiresome.
Well, Mr. Sowell does not have insurance coverage for this operation. And even if he doesn't have any insurance coverage in the future, if he were to develop the other medical problems related to his obesity, he is going to get treated in this country, and it's going to cost a lot of money. So really we're looking at a time bomb in terms of resources necessary to take care of him. And there's nothing else short of this operation that's going to make a significant difference in terms of his weight. There just isn't.
Because, you know, there are so many people that battle this in their own life, you know, being overweight, being obese, you know, and we all know, anyone who's struggled with that knows how difficult it is and knows how tiresome it can be. Through this surgery, there's a way to get past that. There's a way to feel good. There's a way to have a normal life and so forth.
This is the best shot he has at getting control of his weight, and this is overall probably the lowest cost way to do it. And that's really not generally recognized, but that's the truth.
Are you having trouble sleeping? Do you wake up rested? Sleep is important. It's a time when we consolidate memory, we resolve conflicts, and we rest those aching bones and muscles and help our mind get back to normal from the wear and tear of the day before. So what's the best way to get a good night's sleep? First of all, avoid caffeine after 5 or 6 p.m. in the evening. Avoid alcohol near bedtime. Although it may make you feel sleepy, you're not getting quality sleep when you drink alcohol. And you're also not getting all those things about consolidating memory and resolving conflict when you drink alcohol to help you get relaxed to sleep. There's lots of medications for helping you sleep. However, the prescription medicines are ones that should not be taken on a regular basis. They can become a little bit habit-forming. Some of the best medications for being able to sleep are the antihistamines that you can buy over the counter. There's many brand names and they work in a wonderful way. Plus you don't get addicted to them. So have a good night's sleep, don't snore too loud, and exercise regularly. That'll help you sleep a lot better.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann breast centers, what they'll see is a group of dedicated breast radiologists. So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy and our practice that radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look, but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this, you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an Austin bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
For more information on any of the amazing doctors you've seen on today's show, or to find a doctor that best fits your needs, go to our website, bestdocsnetwork.com.
That is the place to go. Right now, Candace, the place to go is our next best doctor. It's oral surgeon, Dr. Kent Stobaugh.
When I used to bite, I felt my teeth not grunting properly, and it was painful in my upper, especially my upper part. It was painful, and I don't think that was normal.
Reynaldo came to me, and he was missing some teeth on both sides in the lower jaw, and he had, I would say, compromised dentition in the upper jaw, and which was fairly non-functional and not very aesthetic.
I did not eat things that I like. I could not, because I felt that if you eat anything that is hard and I bite hard, it was breaking it.
Sometimes it takes a little sight, we call it sight development, and so we did 2 lower implants on the right and left in Reynaldo, and that was reconstructed, and then he decided he wanted to do something with the maxillary, we call it, or the upper jaw.
I felt a humongous difference on taste and how I approach food. I no longer looked at food and thought, I would like to eat it, but I'm better not. That was not anymore what I was feeling. I see if I feel like to eat it, I take the bite and eat it.
Oftentimes implants can be placed and restored immediately, and on his particular case, which is a large upper case, we were able to accomplish that for him.
It is being a totally improvement from my daily work to my daily eating. And I can see from a long future to come that I will have my smile and I will be confident talking to people, because no one can tell me that what I have is not mine.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
I had 2 children, and I nursed them both, and my breasts were completely saggy and gone.
Aisha came to me after she had 2 children. She was interested in improving the appearance of her breast after breastfeeding and childbearing. They had lost some of the fullness, and that typically happens after giving birth.
I simply wanted to go back to the way I looked before I had children. I didn't want to look unnatural in any way, and he completely understood that, and he had a very good understanding of what both me and my husband wanted.
That's the most common question, is can they get that body back after children? They may not necessarily get that exact body, but we certainly can remove the extra skin, tighten up their waist, and give them that figure back that they had before.
The procedure went very well, and the recovery time was easier than I thought. I mean, I thought the tummy tuck, which I almost didn't want to do in the beginning, and I ended up doing, which I'm very happy with, was actually much easier than the breast augmentation. I was probably in bed for about 5 days, and then not really back to myself for about 2 weeks, but 4 to 6 weeks after that, I was completely fine, like nothing had happened. I felt great.
Typically after having children, women have extra skin and some fat along their tummy as well as on their hips. And this is, even with all the exercising, many people can't lose that weight. And so if they've completed their childbearing, that's the perfect candidate. With the breast, many times again, there's postpartum involution of the breast. So many times again, after childbearing, they can't reverse this effect. And again, that's a good candidate.
He was very, very nice. He was very applicable to my needs. You know, he talked both to me and my husband about what kind of results I wanted.
Someone who, like herself, who's very fit and wanted to enhance the appearance of her breast after childbearing, this was a perfect case for her.
And he was so professional and so nice. It was fantastic, fantastic experience.
Well, Keith came to see me because he was having recurring sinus infections and facial pressure and ugly drainage out of his nose, and he seemed like he was sick all the time.
And like I said, I travel to China an awful lot, and it's a pretty exhausting trip, and I would inevitably end up getting sick, and and it would last for 2 or 3 weeks. And
we're designed to breathe through our nose, right? We're not designed to breathe through our mouth. Air comes in the nose, it gets warmed, humidified, cleaned. That's why if you breathe through your mouth, 2 or 3 breaths, you already feel it desiccating, getting all dry in there, and you want to breathe through your nose. So I always tell patients, you have 2 patients, both have allergies. This guy can breathe through his nose and this guy can't. Who's happier? Everybody knows the answer. Anyway, so he was having these complaints, so I looked at his nose. He supposedly had a previous septal surgery, but he still had a bad septum, and he supposedly had previous sinus surgery, but so just because you've had sinus surgery doesn't mean you've had all of your sinuses addressed, if indeed they all needed to be addressed.
a month later, I was feeling better than ever, and actually took out a bunch of polyps from my nasal cavity up in my forehead. That I used to get sick anytime that I was extremely exhausted, and I travel a lot, and every time I would get sick. And since then, I haven't been sick.
What I find is patients who have had sinus surgery and they've had like some miserable post-op experience, and then on top of that it didn't even work and they're still sick, they're like, well, I've already tried that, it didn't work, and it was miserable recovery, and I'm not doing it again. And so they live like the rest of their life with recurring sinus infections and chronic congestion.
All the technology he's got that he can show you, look, this is what happens, and it's kind of interactive type deal. And I can't speak for somebody else with similar issues and how bad their situation is, but it worked for me.
And I love those patients when they finally come in to see me, because I teach them, like, look, you've had surgery, but this is what was done, and this is where you are, and if we fix this area, you won't be like that. Keith is just that patient who's gone through it once with a bad outcome, and now is very happy.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common, and I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor.
It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic, and the patient will go home, again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop. And it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
Do you have headaches? Of course you do. You're a human being. We've all had headaches. There are different kinds. There's migraine headaches. Those are not the most common kind, but they're the most bothersome. They are usually pounding, throbbing headaches, usually on one side of your head, often accompanied by nausea and vomiting. Sometimes there's light sensitivity or noise sensitivity. Best way to get rid of those is to take some over-the-counter pain medication, even drink a cup of coffee real quickly. Sometimes going to sleep will help get rid of one of those headaches. By far the most common headache is the muscle headache or a tension headache. This is the headache that may last days and days and days. It's usually a squeezing type pain like a band around the top of your head, or it can be right in your temples or your forehead or the base of your neck. It's not throbbing, it's steady, and it's caused often by stress, and sometimes it's caused by taking pain medication too often. It can be like a rebound headache. So what should you do for these headaches? There's medication for them. First of all, try relaxation, try sleep. Exercise always helps headaches go away quickly.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, but with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start, doing for me now, just getting my body back to the way I wanted it to be. And I really didn't think of plastic surgery, but I did my research and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and that's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that whole measure back to her exercise that she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition, so that was back in 1999, so I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, to work out in, it's like things I didn't think I would be able to do again, thanks to Dr. Bancroft, yeah.
That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the great doctors in the Houston area that help change people's lives.
That's right. For more information on any of the fine doctors you've seen on today's show, just head to our website at bestdocsnetwork.com.
And if you have a question or comment for us, or is there a doctor that has helped change your life, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
Thanks for tuning in. We'll see you next week.